So I'm Smita Jacob. I'm Director Policy at Asian Venture Philanthropy Network, Singapore. So it's a very momentous year actually, not just for India but also globally. Because if we look at the history of G20 itself, it's for the first time that the global south is going to consecutively be hosting the G20. It started with Indonesia, it's moving to India, going over to Brazil, and then South Africa. So, if we try and understand the geopolitics of this, what it means is that the global south itself is leading the entire conversation now on what impact priorities are, what are socio-economic priorities for the entire world. Also, the other important piece is that it's also for the first time that two Asian countries are hosting this consecutively. So, really, this is the decade for Asia to lead. And in that context, when India is now coming into picture for leading G20 this year, what is critical is to really look at what is it going to try to do for SDG 3, which is focused around healthcare, and what are the key aspects that can be focused on. Our understanding is that one of the key aspects to focus on is going to be infrastructure for primary healthcare. That is something that India can demonstrate doing really well, and it can be taken forward to the entire world to demonstrate what that can look like. No other country will be able to demonstrate the scale that India will be able to. And if that can actually be a successful case study, I'm sure India can come out to be a leader in this entire space, because honestly, primary healthcare and the infrastructure related to it is the crux of a lot of the health related issues, healthcare related issues that there are. We continue to focus a lot more on infrastructure in urban areas, tertiary healthcare as well. But primary healthcare, especially in rural areas, is really critical. And India can actually play the role of being a leader in this. And there is a lot of focus as well on it. So we are really hopeful that at the end of this G20, India will be able to pave a roadmap ahead to take it forward to show the world how the entire primary healthcare infrastructure can be focused upon. So the G20 today is, again, going back to what I said earlier, is really being led now a lot more by Global South. And while we look at that, it's very important to look at what G20 Indonesia was able to do. Indonesia was able to really set forth the entire Asian context, find Asian solutions to the global problems that there are. And I think it's very critical now that we take forward the presidency, when India is taking it forward. We look at what Indonesia was able to do, many other Southeast Asian countries have also been able to do. ASEAN is a great platform, similarly, where a lot of good practices are shared from across Southeast Asian nations. And I think that's a good space for India to start looking at best practices which can be adopted. For example, there's a lot more focus now in G20 on how developed countries do rely much more on developing countries for establishing global healthcare supply chains. And that's a very critical aspect which can be taken up. And India plays a very important role in the healthcare supply chain globally itself. So the idea that we want to look at while we are solving for healthcare overall is to also look at Asian solutions to these problems, rather than trying to adopt only solutions that are being deployed elsewhere, say in Western countries, which may or may not completely fit to the kind of problems that especially developing countries in Asia face. So G20 now, when we are looking at what have been the lessons that we have learned so far, it's very important to look at what Indonesia has been able to do, and similarly many Southeast Asian countries across. So even ASEAN is a very important platform for India to learn from. The key points that were mentioned in the leaders' declaration this year, the G20, was also strengthening of supply chains, global healthcare supply chains, especially in developing countries, and how developed countries can actually support developing countries in this space. In the same breath, I want to say that G7 is also therefore continually relying much more on the G20 countries, the other countries, to really come back with solutions to the global problems. In this context, I think what's most important to look at is what are Asian solutions to these global problems. For example, how can community healthcare be really strengthened? What is the role of community in prevention? That is a very critical piece, because preventive healthcare at the moment completely relies on individual behavior, and individual behavior is guided a lot by communities. For this to look at solutions, it's really important to look at countries which are much more similar, and I think Asian countries have had some fantastic examples of how universal health coverage has worked, how primary healthcare has worked, how community programs come together. In India itself, one of the best examples is really looking at even ASHA workers. So, what is critical then to close the entire financing gap that is there, and the financing gap, especially for SDG 3 in healthcare, has become even wider in the last 2 years post the pandemic, because a lot of funding has been diverted post COVID towards post COVID recovery itself. What is critical in that space then is the role of catalytic capital, which is how do we actually look at who is investing in the first mile delivery. I think the first aspect around that is the role of blended finance itself. In blended finance, we look at two different kind of investments. The first round of investment should come in ideally from the public sector or even a philanthropic organization who can take the first loss, also minimize the risk of the entire portfolio and build a good proof of concept, showcase the model, following which that itself signals then to private sector impact investors overall or any kind of investors to come forward and then start investing in those areas. To go back to the example of primary healthcare itself, that is absolutely critical how the government or philanthropic organizations can play that role. In India, there have been some fantastic examples, including CMC in Vellore, for example, where the government or philanthropy together have come, created a fantastic healthcare model in a rural area and showcased it, leading to then much more private investments coming up in the same area. What private sector actually needs is that first round of signals that's coming, because they cannot be expected to close that. The overall SDG financing gap today is $4.2 trillion, which means it's about $170 billion per year for just developing countries. This cannot be closed alone today only by looking towards governments or only by looking towards charitable organizations or philanthropists. We need all sorts of capital flow coming together to be able to close this gap. And that's why it's absolutely critical to look at models such as blended finance, which explores public private partnerships at scale and begins to close the SDG financing gap in a much more strategic way. So G20 2022 was a very interesting year because Indonesia actually launched a legacy program which is called the Global Blended Finance Alliance. This is a very key building block towards strengthening public-private partnerships across the entire social impact space and also closing the entire SDG financing gap. We, AVPN, were a founding member of the Global Blended Finance Alliance. And what we're hoping to do is take this across the next many G20 presidencies that's coming up to really strengthen the entire policy framework. Today, what is actually missing in closing the SDG financing gap is very strong policy frameworks for private investors, for impact investors to come forward and really invest in closing the gap that is required for achieving the SDGs at the earliest possible. For that, we require strong frameworks like the Global Blended Finance Alliance. And taking that forward, India will be actually able to build that, strengthen that. We have a lot of interesting examples. We are one of the first countries to really mandate CSR spending on social impact. We have also got the recent social stock exchange that's come up. So there have been a lot of interesting regulatory frameworks that's come up in India. What is now important is how do you actually strengthen that and look at aspects such as healthcare and look at PPP models using blended finance as a tool to close that gap. So AVPN's entire focus is how to move capital more strategically towards impact. And the key idea is to close the SDG financing gap itself. Now, with respect to SDG 3, which is focused on healthcare, one of the aspects that one of the key interventions we've had is the pool funds, that's what we call it, which is a model for blended finance to come forward, for capital to come forward more strategically. So we've been able to bring together some key funders such as Johnson & Johnson, BMGF, Sequoia, Macquarie to come together and invest in strengthening healthcare systems across Philippines, Indonesia, Vietnam, Thailand. And that's the key focus area that we're looking at. And we're trying to really look at how these pool funds can actually be taken forward. Because what's important today is not just that capital itself moves towards impact, it's really important that capital moves more strategically. So for that, we require anybody and everybody who has the capital to come together and strategically start investing rather than doing many different piecemeal approaches.